back with Dr. Diez, a dentist in Tampa. Dr. Diez, in your office, are you doing sedation dentistry? And can you tell us a little bit what it is all about and what are the benefits to patients in that area?
Sure, I'd be happy to. We perform oral sedation in our office. The beauty of it is you come into the office, we give you some medication that you take orally, and you wake up a few hours later with no memory of what happened, and your dental work is done. It's really that simple. It's a beautiful thing. We found that even post-op discomfort is virtually nil when patients are sedated for dental treatment.
Well, let me ask you, so when you sedate them with the pills, are they like sedated like if you have appendix operation, or can they still be, are they awake and alert and can talk to you, or what's the deal there?
It's called conscious sedation. The beauty of it is if we have to communicate with the patient, we can. The patient's asleep, but we can usually, push on their shoulder or shake them a little bit, and they can respond to us. They will have no memory of their response, but their response doesn't make sense. You basically have amnesia from the medication that we give you. So.
I see. So they walk away. Is that where the saying basically comes? Like they walk away and they pay the bill and they kind of like says, "Oh, I need to prepay for the whole surgery," because they didn't know they already had it. Is that a little bit? Is that a little bit like that, or what?
Well, go ahead.
No, you go ahead.
No, for one, all decisions, including financial decisions, are made prior to the appointment. But sometimes I have to ask the patient to bite, okay? Mm-hmm. And, we can just tap them on the shoulder and ask them to bring their teeth together, and they'll respond to us. But again, for lack of a better phrase, they're out of it. And if you ask them the next day or that afternoon, do you remember the conversation we had when we asked you to bite? They have no recollection of it.
I got it. So, obviously, one of the, thing is you obviously have no pain. I think sometimes dentists need to use it because some of the Novocaine doesn't work for whatever reason. You know why, but so then this does work. However, there's also this, some people, of course, have fear. And then there's the fact that when you do a long procedure, like you could be doing many, many teeth in once, like 2, 3, 6 hours of work, which without it, even if a person isn't dental phobic, it doesn't have major problem. I know that when my dentist does an hour of cleaning and picks away in it, I sit there and start counting sheeps. It becomes rather annoying to just sit there. So that falls away. The patient, time just flies. It's gone, and he's out of it, and he comes to him again, and he doesn't remember any of that, and you can do lots of work, right?
Yeah, most of the time the patients will say, and this is not an exaggeration, they will say, "Are we done already?"
What I meant by they sit there, you're asking him, you say, "Oh, that this is X amount of money," and he says, "Oh, you want me to prepay?" Because he doesn't remember that he did this thing already.
We're a little more honest than that around here, Helmut. But most of the time that's what they say, and that could have been a 3 or 4 hour appointment. There's different medications we use for different times that we want to sedate the patient, but it's no different than when you go to sleep at night. You wake up in the morning, it doesn't feel like you've been asleep for 8 hours. I mean, that time goes by like that. Right. So the beauty is you wake up and your dentistry is done, and it was painless.
Mm-hmm. So it's a big advantage for guys who do have a lots of work. Instead of coming to the dentist 3, 4, maybe even 5 or 6 times, they can get it literally done in one day. So that day they probably take off work or whatever it may be, Saturday, and they're done, rather than destroying for 3 weeks every week a whole day almost.
That's exactly right. It's a very efficient appointment. Very, very efficient appointment.
Mm-hmm. Okay. And so you don't remember certain saying, fine, but that doesn't have any side effect? I mean, any major, no major side effect known?
No, we usually ask the patient to take the day off because even after sedation, they wake up, but they're still a little groggy. You shouldn't be operating.
You don't want them to drive a Lamborghini home.
No, we always have a driver. You don't want them operating any heavy machinery. But other than the groggy feeling, there are no side effects from the medication. So it's a well-known medication. It's been used for years. Very, very safe. And like I said, it works fantastic. It really does.
And the guy can go to work. He can go to work next day again.
Definitely, without a doubt.
Okay.
Yeah.
Right. And what about?
And like I was saying, that a lot of times with the sedation, the post-op discomfort is so much less. The physiology behind that, they don't really know why, but patients rarely ever need any pain medication, no matter what procedure we do.
I see. Okay. Wonderful. So maybe it's just because they don't, mentally they don't go, well, he drilled my tooth, so that must hurt, and it hurts.
Right.
So if there's nobody in the forest hearing the tree falling, then did the tree really fall, right?
It's a phenomenon of sedation, but it's a wonderful thing.
Exactly. Well, we don't really care. Now, what about the dental phobia guys? There's a few guys out there who really, can you help them out, like even before they come to your office, that it all gets like, does sedation dentistry have anything to do with that?
Yeah, I would say 90% of the patients that we sedate are dental phobic. And there's different levels of sedation. We can lightly sedate a patient to do an exam. I mean, sometimes patients don't even want to take x-rays. They just fear the whole the visit. They fear being in a dental office. So just to get them through an exam so we can diagnose them, we can lightly sedate them. And then for treatment, we do our heavier sedation where they actually are asleep. Mm-hmm. So yeah, there's different grades of sedation.
So it's a good thing to do.
It's a wonderful thing to do.
Okay.
So.
All right. Wonderful. Do you have to be specially trained in that to be able to perform it?
Yes, we do. Yeah, there's several courses that need to be taken. Not only in sedation, but in basic life support, in pharmacology, because you're putting medication into the human body, and everybody responds differently. So there's a lot of research that goes into sedating each individual patient. For example, before we will sedate somebody, we actually will hook them up to our monitors and make sure that everything's healthy. Their heart rate, their breathing rate. We're just very thorough to make sure when they're sedated that everything goes well. So, and as long as you do that, everything does go well.
Good. So, not every dentist will or can just do sedation dentistry. He has to get specially trained.
No. That is, yes. You have to be specially trained to perform conscious sedation.
To be legally able to perform it.
That is correct. And every state is different. So I'm speaking for Florida where we practice. But yes, you have to pass and have certain criteria and education and a certain number of hours of education to perform this type of sedation that we do in our office.
Okay. Well, all right. Again, very informative and showing us what's out there in dentistry, and that life really has changed there too. Thank you very much.
Thank you, Helmut.